I'm here today because our institution has decided, quite rightly, that the climate crisis is a major thing for us to be talking about. And advocacy by our institution about the climate crisis is really important to us because it's the biggest existential crisis facing mankind. We also know that healthcare helps produce carbons. One of the biggest producers of carbon in healthcare is working in an operating theatre. And so we're working with all the other surgical colleges and the College of Anaesthesia to share the best practice and best knowledge with everyone to reduce waste, to change the materials we use in the operating theatre and cut down on carbon production. So as an institution involving surgeons, it's really important we speak out about that and share best practice.
We have a really important role as advocates for changed human behaviour to deal with the climate emergency. And as institutions like colleges or pharmaceutical society, whatever we might be, we're membership organisations. We have 15,000 fellows and members across the world. Speaking out about this is something they want us to do, that's very clear feedback, but it gives us a reach to healthcare professionals who, in their daily interactions with their patients and people they care for, gives us a reach for this message. So advocacy, I think, is really important. We then need to lead by example. So I think we've tried to frame it in three ways, Fiona. Firstly, to say what's the impact of climate change on human health, as we've just been hearing about air pollution, respiratory disease. Secondly, what's the impact of the delivery of healthcare on climate change, as I mentioned earlier. And the third really important component is what can individuals and institutions do about that?
It's about keeping up this conversation with everybody and saying that we as healthcare leaders realise there is a threat to human health by the climate crisis, that we have a role in addressing that and keeping up that work and keeping up these conversations. I'm going to sign the Healthy Climate prescription letter and I encourage other people to do so.